Congressman Sestak, welcome in.
Hi, Dom. Glad to be here. Thanks for having me.
Well, thank you. You are the third in line here. I'm not sure if that makes it easier or harder around these. Let me ask you, how much, I've asked each person, Joe Sestak, how much of this have you read of the proposed bill that's out there?
I think I've read almost every word.
Okay.
And, Dom, this is the reason I actually got into Congress.
Right.
My daughter had a brain tumor.
Yes.
You all gave me TRICARE in the military that gave her the ability to be here 4 years later. She initially had 3 to 9 months with that brain cancer. So when it went through my subcommittee, Health, Employment, Labor, Pensions, it was the first one to pass it through a couple weeks ago, I said, I can now retire because this is what I really came to do. I mean, obviously I'm not, but so I have a very personal connection to this.
Absolutely. So I've asked Congressman Gerlach, and Congressman Vitale said he would. The public plan or some form of that we hear that's out there. A, are you wedded to that, meaning Sestak will not vote for this health care plan if there's not a public plan in there? And B, would you put your family in that?
Yeah, I actually voted for an amendment in our subcommittee that said Congress members, I've forgotten the exact wording, would be willing to go into the healthcare plan, the public health care plan that we were pushing for, and I voted for that.
Okay.
Because the public health care plan is, and let me back up to get to your second question, is would I vote with or without it? I believe it's absolutely critical you cannot not have it, or at least a means to achieve what it does, and that is create true, fair competition. Because, Dom, you know that in the Philadelphia region, where 42% of all Pennsylvanians live, there's one company that has not 70% of all healthcare plans, private ones. We used to call that a monopoly. And so having a public healthcare plan that's subsidized not by the government, but by the premiums and copays of those who elect to go there, not by the government, but it's less expensive because you don't have a CEO making $23 million, then it begins to give the competition to that monopoly, which throughout Pennsylvania, 2 companies have 70% of it. So if there's a different means of some sort, which I haven't seen yet, that can actually create that competition to lower premiums, then I'll do it. But that's the only reason.
Well, okay, let me ask you. I don't want to get too far afield here, Congressman. Congressman Gerlach is, and I'm not sure if you sign off on this, something like this called a cooperative for the ability of small businesses to go outside state lines, to have companies that are out there be national right now.
Yes.
Is that something you would support?
I don't know the details, and I'm interested to see what it is, because the Senate Finance Committee, I think it was yesterday, came out with a co-op. It has, in order to make competition, the analysis shows that co-op has to be nationwide and have 500,000 individuals in it.
I think that's doable.
It's doable and it accomplishes this, but that's what I'm saying. What we call it is not important to me. Okay. What it affects is important.
Okay. Let me go to another area, Congressman. Pages 424 and beyond. About 10 pages or so.
You're not going to quiz me exactly.
No, but I'm going to set it up for you, because I trust when you say that you've read it. You're a military guy. You have the highest honor that I know of, and you were an admiral too. So I know that you've looked at this. But I only went to law school. I haven't graduated. And I got to tell you, my head was spinning reading it. I parse it out. What it's about is this death with dignity, living will squad that comes to your house. I read this particularly if the regulations go the wrong way with this, where I see an encouragement of older people toward you're spending too much toward the last 30 days of life, the last year of life. Wouldn't it be better, death with dignity and all that? I read that language to have that. How do you read this provision that people are debating about now?
Well, what it's intended to do is to make sure that there is fair reimbursement for people who are actually near the end of their life, where there is an estimate, and I want to stress an estimate, that 90% of our monies tend to go towards that very last phase of life. The difficulty of it is how do you determine who rebounds, so to speak, in that part of life and lives for another 10 years and who does not? And so this type of assessment is something that I think I am not on the side, and I'm going to be right up front about it, beginning to, as Britain did some time ago, begin to ration out the quality of the care near the end. I honestly believe that if we make a change from fee for service to where you're caring about the quality of the care, the savings in that, particularly as you begin to reimburse not for how many visits, but how healthy people are, that you begin to say, as Hubert Humphrey, and I believe this, that the moral test of a government is how well it takes care of those in the twilight of life, the seniors, as well as those in the dawn of life,
exactly
the children.
Right.
And so that's why I don't believe in rationing it at the end.
All right. Let me take you to one area now. We mentioned cost savings. You're, I believe, a big CBO guy. I am too, the Congressional Budget Office. And the study that they put out, do you see any flaws in that, in which they indicate some of the things that at least the president, Joe Sestak, seems to be proposing do not get us, I think it was a couple $2 billion, nothing to sneeze at, but don't get us huge savings?
Yeah, you're right. This is not dissimilar than the Massachusetts healthcare plan, which has been in existence 2 years. This begins to get savings, but it doesn't begin to bend the cost curve. Let me say first, the House bill is about $1 trillion. We did make it budget neutral, with the exception, and I'm disappointed in this, Dom, that Medicare was going to cut physicians' fees this year 21%, irregardless if we did health care reform. We should have ponied up and said, we'll find that money. So that $239 billion is not paid for.
Okay.
It was a decision not to. But all I said is deficit neutral. Are there sufficient savings? There is for this bill. But if we do not slow down the cost curve with step 2, which the Massachusetts healthcare plan people just announced a week ago, by literally saying, okay, general physicians, we are now telling you that we're going to give you 100,000 patients. At the end of the year, if they're healthy by certain measurements, you get to keep all X amount of money. If they're not, you get only X minus so much. Here's why. You come into a doctor and he takes care of your problem. It's like coming into a garage. But they don't do maintenance on you. They don't test a woman for a mammogram unless she comes in and wants it. So they'll mandate it. In fact, in our bill, it says a person going in today who keeps their health care plan will have 0 copays for preventive care. That type of change, where we get the mammogram shows cancer caught early, doesn't only mean she lives better, but we pay less.
Well, no, wait a minute, though. Okay, I got you, and I'm not opposed to that, but I have to tell you, there's a tonality, not so much with you, but I'm hearing this with the president attacking doctors with the tonsils. Congressman Sestak, you're a fit guy. Is this on the doctors to be preventing, or isn't it that a lot of Americans are obese, and that's what's driving a lot of this? And, blaming this, or not blaming, but pushing it toward the doctors, it's on us, you and I, Joe, as patients.
Well, right now we are incentivizing the doctors, whether you're saying or not. We've pushed it on them by saying we're going to reimburse you every time a patient comes into you. And the health insurance companies do the same thing, by the way, not just Medicare.
Okay.
So I'm just saying change the incentive. Say, if you don't take care of that patient, you're going to get less. I believe government should not, the less regulation, the better. The better it is when it does incentivizing. And that's what I believe.
Parting question for Congressman Sestak, which is the vote. I mean, it would seem to any reasonable person that we'd be glad that this wasn't rushed through, because I think you're a guy that wants bipartisan support.
Yeah.
Not going to get it. When do you see all this congealing and coming together? Do you have a sense? I know but you're inside Congress. I'm not. When do we vote?
I think you'll see in September. The Senate will pass its version of the bill late September, is my estimate.
Okay.
Very early October. The House will pass its bill early September. There'll be a conference around the efforts at a conference in October, and the final vote will be around the late October, November timeline. But I have to tell you, I agree with you. Reconciliation, which we put in this bill, I never want to sacrifice good public policy at the altar of bipartisanship, but I honestly believe the congregation should begin praying together before you have an edict of a schism. And so I would have said, look, we can always come back in 2 months from now, do another budget resolution for reconciliation, which means single-party vote.
Right.
Because I got to tell you, the great things in government are done bipartisan. Welfare Reform Act of the 90s, Civil Rights Act of the 60s. So, Don, you've got a point there.
All right. Well, Congressman, thank you very much, and good luck out there on the campaign trail. I know you're fighting a heck of a fight, and thank you for always finding time for us.
It's great. Thank you.
Congressman Joe Sestak, the third in our series.